Okay, so I have my other video downloading, and I have a bunch of research up that I'm going to try to run through really quick. Just to give you a little rundown of things. I have been really busy with the group. Fortunately, it was one person just, I thought they were kind of like being kind of snarky at me. It was one person being kind of a smart ass, I guess, and I don't know. But it's taken on from there, and other people have been, wondering things, and we've been talking back and forth, and everybody's been very supportive, and yeah. So I've been busy with them, and if it keeps dinging, I'm gonna have to close it out because I keep getting notifications from Facebook. So, okay, let me bring up my bulletins, see if there's anything particular. Okay, one of the main points that I wanted to bring up first before I bring up any research is the biggest question that we have right now, besides why are doctors not being notified of this quicker, is now that the FDA is aware of this and has admitted this and, is supposedly, letting everybody know, why are they not allowing the treatments and therapies needed to, and testing to, for fluoroquinolone toxicity? Why are they not allowing it to be covered under insurance? It's a very good question. Because that's a lot of the issues that people have, is they're running out of money. It's just like the test that I have to go take. It's going to be really expensive. And then the treatments that I have to undergo, the food that I'm going to have to buy, it's going to get pretty pricey. So yeah, I think they should do something about that. That it should be covered under insurance. The medicines and therapies and such. So anyways, in the comments you are going to see, not in the comments, but above the comments, whatever. You're going to see two links. And those two links are links to directories of doctors who are aware and treat Floxies, pretty much, who are aware of fluoroquinolone toxicity. And it is also a site where if you know of a doctor who treats such, you can report that. That way they get put into that inventory. So anybody looking for a doctor in that area can get on there and see if there's a doctor in their area. And I think that is just amazing. I was just brought this information, and I'm going to share it. I went ahead and put my doctor that I saw today, I put him on both registries, and so he's in there now. So yeah, those links will be there. So let me close that out. Okay, and so let's get on to the research. Okay, so first off, I'm going to run real quick. It is going to be real quick because I'm going to post the actual list of the fluoroquinolones down below, and it's a long list. You know what? Most of these I probably can't even pronounce, and I took about a half a semester of Latin. I took pharmacology, and I've been in the medical field for 7 years, and it's really small writing right now, and it would just take me way too long because it's just a really long list. So just a lot of them have been pulled off the market. for deaths and prolonged QT interval, deadly blood, severe liver damage, DNA damage, yeah, so pretty nasty stuff. Increased skin cancer risk, phototoxicity, so a lot of them have been pulled off the market. And it even says that, and I'm going to post it just how it's written, and it has the sources and everything on it, so you can click on that and actually go to the website if you want to, and read all about it and everything. So that's that for the list. So, okay, now let's go to this. Okay, the whole doctors not knowing. There was a report. It was June 6th, so yesterday at 6:30 p.m. I found this report, and supposedly I found it right after it was reported or updated, from Charlotte, North Carolina. And instead of playing the video, it would take me forever to get the video and put it inside my video, just because of how my computer is right now and the software that I have. So I'm just going to read this really quick. Charlotte, North Carolina. A Charlotte woman helped push the U.S. Food and Drug Administration to change the warnings on certain popular antibiotics, but she and South Carolina doctor are worried doctors aren't aware of the ruling. These antibiotics are known as Fluoroquinolones. Popular brand names include Avalox, Cipro, and Levaquin. The FDA now believes they're linked with serious side effects involving tendons, muscles, joints, and the nervous system. It says that the side effects outweigh the benefits for people with less serious infections like sinus infections and bronchitis. Last month, the FDA ruled that the companies that make these drugs need to include stricter warnings with the medications. Doctor, most doctors don't know. But Dr. Charles Bennett with South Carolina College of Pharmacy said, I'd say most doctors don't know about this. He's been warning doctors and patients of potential side effects since 2014. He wants the companies that make the drugs to send every doctor in the country what's called a Dear Doctor letter, making them aware of the FDA's ruling. I think that's appropriate. Quote, it says, Dear Doctor, we want to inform you of important new changes in quinolones. Their risks outweigh their benefits for most diagnoses. End quote, he said. Patient, quote, long way to go, end quote. The Charlotte woman, Rachel Brummett, said she only took Levaquin for 7 days, but since then she has had tendon tears 10 times in 10 years. She blames the drug. Every day, things that most people take for granted is difficult for people like me. Going to the supermarket, most people don't think about it, but for me, it will tire me out, you wouldn't believe, she said. She spent months pushing the FDA to require more warnings for the drugs. Now Brummett and her group, Quinolone Vigilance Foundation, there's a website. It's www.saferpills.org, is launching its own campaign to make doctors aware of the ruling. And that's interesting. I hadn't read this far. So that's awesome. Good job, Miss Brummett, and I hope I'm pronouncing your name. Brummert. Sorry, Miss Brummert. It's really small writing. I'm sorry. Awesome. Good job. Brummert is speaking to doctor groups and meetings with the CDC in Atlanta. She said that she met with officials there last month to discuss ways to track the side effects of these drugs better. Quote, we've come a long way, but we've got a long way to go too, she said. So that's pretty much the basic of that. So again, if you want that website, it is www.saferpills.org. Okay, moving on to the next one. Okay, so everybody knows the latest FDA announcement was 5/12/2016. I think everybody who is a Floxie is going to remember that date, 5/12/2016. Here's the thing, when you get on the FDA thing, because what I did was I Googled Fluoroquinolone adverse reactions, and it gave me this. But it has nothing about adverse reactions. It just says related information. And it talks about how stronger warnings requested for fluoroquinolones. And it just says archived. It doesn't have a date. And then the next one up is July 8th, 2008. Information for healthcare professionals. Fluoroquinolone antimicrobial drugs marketed as Cipro and generic Ciprofloxacin. Yada, yada, yada. Archived. And then the same day, FDA requests boxed warnings on fluoroquinolone antimicrobial drugs. So, before 2008, it was already requested. Looks like October 2008. Warning on tendon injuries with fluoroquinolone antibiotics. 6/1/2010. FDA public health alert. Healthcare professionals warned not to use certain intravenous metronidazole, ondansetron, and ciprofloxacin, Cipro, due to potential contamination. And that's weird because ondansetron, I can never pronounce it, and it's one of my medications, is Zofran. It's like Phenergan. It's an anti-nausea medication, but they usually give it to you because it doesn't make you sleepy like Phenergan. So that's interesting. That's something I'll be checking out later because I get IV Zofran a lot whenever I go to the hospital because I can't get IV Phenergan. So that's interesting. I didn't read that. Again, another thing I found that I didn't read earlier. So anyways, then you go to 2013. It says FDA Drug Safety Communication. FDA requires label changing to warn of risk of possibly permanent nerve damage from antimicrobial fluoroquinolone drugs taken by mouth or by injection. 2013. Then 5/12/2016. FDA announces safety labeling changes for fluoroquinolones. I'm getting so tired of saying their damn name. Yeah. So it's the same thing over, dot. Okay, so, okay, yeah, I was going to post that to you all. I just want to make sure I didn't forget anything before I get to anything else. So I was hoping to have a better idea of the actual released adverse reactions. My hair is really getting on the nerves. I asked the doctor about the alopecia, and he said he'd have to look into that because my hairline is like receding, and anytime my bandana slips, I get these baby hairs that are okay. I'm sprouting antennae. So I just Googled, so instead of putting like FDA adverse, because what I wanted was from actual FDA. And there was a woman in one of the chat rooms who mentioned that she had the list from the FDA, and she has yet to post that. I'm sure it's probably a lengthy process, because I'm sure it's probably pretty long. So I just typed in Cipro side effects, okay? I don't know what happened to my camera. I hope the other part of this recorded, because I really don't want to have to go back through this. I'm going to start with the, this is the last part of the video, so I really hope the whole other part recorded, otherwise I'm going to have to go back through everything again, and I've already erased everything. I really hope it's safe. Please tell me it's safe. Okay, because now I can just link the two videos together. I'm like praying that it's safe. Because I know I'm shooting like a lot of information at you at once, but I don't want to like ramble on for an hour. I just want to give you some information, help you think a little bit about it, give you a kind of a glimpse into it so you can go on your own and research whatever you want. So I'm going to go over the side effects. So I simply just Googled, and I actually got on to I think it's drugs.com or something like that. And it says adverse reactions in adult patients during clinical investigations with oral and I can't even see that word. My eyes are getting really bad. Okay. With Cipro, 49,038 patients received courses of the drug. Most of the adverse events reported were described only as mild or moderate in severity, abated soon after the drug was discontinued, and required no treatment. Cipro was discontinued because of an adverse event in 1% of orally treated patients. The most frequently reported drug-related events from clinical trials of all formulations, all doses, all drug therapy durations, and for all indications of Cipro therapy were nausea, diarrhea, liver function, tests abnormal, vomiting, and rash. Additionally, medically important events that occurred in less than 1% of Cipro patients are listed below. Well, apparently, they got their percentages incorrect, or they did not test the right patients, or they did not wait long enough. Body as a whole: headache, abdominal pain, discomfort, foot pain, like just pain, foot pain, pain in extremities, injection site reaction as Cipro intravenous, cardiovascular, palpitations, atrial flutter, ventricular ectopy, syncope, hypertension, angina pectoris, myocardial infarction, cardiopulmonary arrest, cerebral thrombosis, phlebitis, tachycardia, migraine, hypertension. Yummy. Central nervous system: restlessness, dizziness, lightheadedness, insomnia, nightmares, hallucinations, manic reaction, irritability, tremor, ataxia, compulsive seizures, including status epilepticus. I think that's okay. Grand mal convulsion. That does not sound fun. Lethargy, drowsiness, weakness, malaise, anorexia, phobia, depersonalization, depression, potentially culminating in self-injurious behavior, such as suicidal ideations, thoughts in attempted or completed suicide, paresthesia, abnormal gait. Fun time, guys. Gastrointestinal, painful oral mucosa, oral candidiasis. For those of you who don't know what that is, it's thrush. It's a yeast infection in your mouth. It feels and tastes and anything you can imagine gross. I've had it several times from most antibiotics. I get it almost every time I have an antibiotic, including Cipro, and it's gross. It is a white film that covers your tongue and the roof of your mouth and the inside of and the back of your throat. And when you brush it, it's like sloughing off your skin. And then they give you this orange rinse that you have to rinse in your mouth. And God help you if you've got any cavities or anything in your mouth, because it burns. Oh my gosh. And then they give you Difloxacin or something to help get rid of the yeast. It's horrible. It's nasty. It's a nightmare. And then you gotta boil your toothbrush. After you use your toothbrush, every time you use toothbrush, you gotta boil your toothbrush. Or if you use just a simple toothbrush, you can just keep throwing them away. But I use one of the spin brushes, so I had to keep boiling mine. So, okay, moving on. Lymphadenopathy, petechia. I know what that is. That's the yeah. Lymphadenopathy and petechia are the hemic and lymphatic reactions. Metabolic and nutritional. Amylase increase, lipase, I'm probably not pronouncing half of this crap right, so don't correct me, okay? And I have an accent, so I may be pronouncing it correctly, but like a vowel might be off. It's the way I pronounce it. Lipase increase, lipase increase. I don't know how LIPASE increase. I know what it is, but I don't know how to pronounce it. Hyperglycemia and hypoglycemia. Musculoskeletal. I can't see it. I've never even seen this word. Arthralgia, or back pain. Or can they just say back pain? Joint stiffness, achiness, neck or chest pain, flare-up of gout, muscle weakness. Renal and urogenital. Interstitial nephritis. I don't know what that is. It does not sound good. Nephritis. Again, I don't know what that is, but it does not sound good. Renal failure. Polyuria. Urinary retention. Urethral bleeding. Vaginitis. Acidosis. Breast pain. Fun. Respiratory. Now, keep in mind, Cipro is usually overly given for respiratory issues. Dyspnea, EPISTAXIS. Laryngeal or pulmonary edema. Hiccup. hemoptysis, HEMOPTYSIS, bronchospasms, and pulmonary embolism. Skin hypersensitivity, allergic reaction, bursitis, urticaria, photosensitivity, phototoxicity reaction, flushing, fever, chills, angioedema, edema of the face, neck, lips, conjunctivae, or hands, cutaneous candidiasis, that sounds fun. Nystatin powder to the rescue, some hydrocortisone cream, hyperpigmentation, and sweating, special senses. I don't think they're talking about spidey senses. Blurred vision, disturbed vision, change in color perception from over brightness of light, decreased visual acuity, diplopia, eye pain, tinnitus, hearing loss, bad taste, chromatopsia. Like, these, and they say, okay, these are all issues people are experiencing now. A lot. And they were saying, oh, these only happen 1%. Do not bark. Do not bark. There are children outside playing, and she's going to bark. Good. Oh, God. They even have, I'm not even going to look at that. They have adverse reactions in pediatrics. I'm not even going to look at that. I can't make myself do that. So I'm going to stop here and make sure that the first part of the video recorded. Otherwise, I'm going to be redoing this whole thing. So that's just a little bit of info to give you, and I will give you those links and spreading the word, and I will let you know what I know when I know it. Hopefully I'll know something about those tests soon. I know one of them, the heavy metals test is going to be about $200 or $300. So, kind of stressing out about that one, because that's one that he really wanted me to do, although I'm more concerned about the other one. If I don't know. I'm going to have to figure out something. So, yeah. Share the links, spread the links, whatever you want to do. That's all I got for now.